Today I am in Chester at the home of a general practitioner, Dr. Roopa Adke, and I'm really excited and delighted to cover this amazing story of the Indian health migration to Britain. You know, people coming from India to actually rescue the health of the nation, improve the health of the nation. Never forget the fact that it costs at least £500,000 to the Indian government to train a doctor before they come. So in a way, when Britain gets ready trained doctors coming here, it's actually India providing grant aid almost to Britain. But it's not just about the profession, it's not just about their work here, but it's also how they deliver the work, the ethic that they bring to this country, the way they relate to one another, the hospitality and the spirit that they bring to the work that they do, and above all, the way in which they build communities wherever they go. Shenoy, do you want to start and tell us about what you do and how you have brought your culture to this land?
Thanks, Patil. I'm Shenoy. I'm one of the anesthetic consultants working in North Wales, not exactly in Chester. And I agree with your fact, saying it's India's loss and Britain's gain when all trained doctors from India are actually coming and working here and supporting the NHS system. From our point of view, as I said, we all are from different places in India, and we've all got together here and with a similar single cause as to supporting Indian culture. Working wise, I've been here for now 8 years. I've been trained in India for 8 years for becoming an anesthetic, after which I've further trained here for another 8 years before I became a consultant. So it's a long time of training. But as I said, the work wise, maybe I work about 10 hours a day, but overall the working time is about 48 hours, and we cater to a lot of different specialities. I'm an anesthetist, so I do different various specialities, and we do get to meet people, patients of coming for different operations in a stressful situation. So as I said, Atul, it's like what we do in sense from our point of view is, even though there's a very limited contact with the patient and no much follow-up, but still I'm sure if you ask these patients here, they are very happy if it's an Indian doctor or someone, because I think we understand their hunger for more communication and talking and things, and we do understand what they really feel like when they come, and we do spend more time with them, more than I'm sure the local doctors do.
Fantastic. So, Rajiv, you are a nurse,
yes.
And we have it's well known that Britain has a huge shortage of nurses, yes. And the majority of the nurses that come here and provide skilled service come from abroad. Can you tell us about Indian nurses in Britain and the work they do to help the system?
Yeah, thank you, Atul. I came basically from India, trained in India as a staff nurse, graduated from Karnataka University, and I came here in 2001. And initially I came to the private sector where I worked in the nursing homes, where we look after the nursing homes are different here in India, because when I came to this country I thought the nursing homes means the nursing homes like in India, like inpatients and the doctor services, laboratories, X-ray, all those things. But when I came and entered to the workplace, it was a completely different kind of environment there, because nursing homes are basically like an old age home, and all the elderly people were there, and it was a different experience when I started. And when basically I came, it was my first experience leaving my family and all, coming to this country, and one way it was a happy moment, another way it was leaving everybody at back and coming alone, and it was a different experience. And initially it wasn't a very good experience because we didn't have a proper accommodation, proper wages, even though they used to pay us the wages less than the normal payment for the people who works here. But still we went through a bit hard days, but now it is a lot better since I started working, joined the NHS and working for the NHS. And I think from my institution itself, nearly more than 250 nurses are in this country working in both in the private and the NHS sector. And my background is my parents are teachers, and I come from the well-cultured and I'm a joint family from India. And when I came here, and it was a different, when you speak to the people in the nursing home, they all tell, like, oh, my son is living somewhere and daughter is somewhere. And when talking to these kind of people, it was something strange feeling I was having. And how can people live without the parents, father or mother, and leave them in somewhere place where somebody can look after them and live and go abroad?
To talk about the festival and the group that you've created too.
My name is Pranava, and I'm one of the doctors working in North Wales, not exactly in Chester as Shenoy said. This actually began with Roopa really asking whether we should just have some sort of a cultural or teach the children simple shlokas. From there, the thought germinated that we should have something like this, because there are such institutions in Manchester and Liverpool, but we can't be travelling so much to these places just to get the same things that the kids in those areas get. So we just thought that we should start something like this in the North Wales, Chester area, so that the children get to know something about the culture of India. And that's how we came about starting this association called Sammilan. I'm sure Roopa will be able to brief you more on that. The launch was actually during the Ganesh Chaturthi. We thought that is a good way of starting anything auspicious by worshipping Lord Ganesha. And the function was a huge success, because basically it was not just we had Indian culture in it, but we invited the local people to come and have a look so that they know how we celebrate festivals and what kind of food we eat, how we dress up, what do our children learn at home in India, just for them to have a look at Indian culture or Hindu culture, and just have a feel of it. And I'm sure most of the comments that we got from around the feedback that we got was excellent. Everybody just liked it.
So that's fantastic. I mean, the kind of message I'm hearing is that not only are we bringing our culture here when we come to this country, we're also bringing an open mind and are very keen to build bridges and to build bridges of mutuality and understanding. And we've arrived in Chester this morning, and we've been staying with Dr. Roopa Adke, and it's just incredible how, in spite of being a mother and a busy professional, the kind of hospitality she has provided, and she has created this platform to bring everyone together, and she's quite humbly serving us the tea, cooking the food.
Thank you, Atul. Very nice words you're telling about us and about me and the association. I think it was very simple thought, as you just mentioned it. It is creating a home away from home, and obviously living here for 15 years, this is the home. But at the same time, we want to value our cultures and things, and that's how the thought came on. And it is important when you want to lead something, motivating the people and meeting the people who have the similar ideas or views. And luckily, we five have come together and proceeded to do this association. It's not only five of us, we have had a huge support during the festival we did, not only from Indian culture, but also people from the local community. There are lots of other people who have been helping us, like English people and the Welsh people. So it has been a grand success, and we continue with this success and carry on.
So tell us a little bit about your patients. I can just imagine what you're like as a GP. You must be a very popular doctor.
Thank you. Probably that's what I hear anyway. It's a profession, I really like it. Initially, I worked in the hospital for several years, then moved on to the GP, and I'm thoroughly enjoying that one. Apart from just doing the general practice, I also lead the gynae in my own surgery, do family planning clinics, and a special clinic called Substance Misuse Clinic, where you meet a very different population there. who are all either drug addicts and coming there for their supplements. So they all need a very different approach. And as Rajiv sort of mentioned, which is exactly true, the way the social structure here, which we tend to see every day, is that yes, the social services look after my parents or somebody else, and very, very different approach. We kind of sort of, seeing very differently coming from India. And we sort of tend to try and involve the family, in a subtle way, telling them, family support, how important for elderly people, and including given sort of, helping them in that sort of.
So effectively you bring your emotional intelligence to your work and you apply it, and that comes from the upbringing.
I think yes, that's the upbringing, and if my father was going through any of the surgery, we would like to be there if as much as possible, and that sort of things. I'm sure as a human beings that will be the requirement for anybody, and we try and bring this across to our patients in a way they can understand.
Excellent. I mean, Sirpa is a technologist who has come from India and lives in Chester. And that's one of the other big wave of migrants. We did a story earlier about a family in Ipswich who had migrated on a technology kind of contract. Sirpa, what do you think about the link between software and culture?
Thank you. Link between software and culture is a hard question as it is. We can't bring the culture into the software, definitely. That is not possible. But we do maintain the culture, even though whether we work as a software engineers or we do work as in the medicine professions, because the culture is something you are brought in with. You were brought up with that, you were taught with that. It's something that we were fed with when we since our childhood. But the culture into the software industry it doesn't happen as it is. We try to bring in the culture between the software engineers, and we try to form a community, and we try to meet outside through the associations or attend other associations programs, and we transfer whatever we had the values of our culture to our children by taking them along, showing them the other side of the world where we live is actually not where the culture is, where our culture is. So take them to the associations, the meetings, and that's the way we bring the culture into our software community, but not into the software industry as it is.
Fantastic. Do you think culture influences your style of management and the way you relate to other colleagues and team members?
Not culture. There are advantages as well as disadvantages. As Indians, we are hard workers. We put lots of energy. We come up with so much of motivation, enthusiasm into the work. But if you have a team, I'm a team lead, and if you have a team full of English or British people, I do see in this generation there is a lack of that enthusiasm and the motivation and the hard work. So as a team lead, you would expect that much of hard work as you would usually expect to see in the fellow Indian. But then that you have to do, you will have a disadvantage of your expectation, and that what you actually get is not meeting up. But on the other hand, you do understand that the work has to be done, and you have to bring the best out of the people. So you do what is the best to get the things done and produce the best product to the business.